Can you guys hear? We're not used to this like auditorium style moment over here. So before I get started, I just wanted to thank the mayor, our city council, and our command staff and public health. Today is a really big day, I believe, in terms of how we respond to mental health calls. Now, everybody knows in Bloomington, I've been unapologetic. If you break the law, you get one of these orange jumpsuits. And I've been really expressing that we don't have the red light district in Bloomington. We have the orange jumpsuit district in Bloomington. But today, we're going to talk about the compassionate service district in Bloomington. And that's an aspect that sometimes we don't really talk about. So the intersection of law enforcement and mental health is about to change. Strike that. Brain health, right? The brain is an organ, right? And we often say mental health, but I'm going to interchange brain with mental health because the brain is a physical organ. And if you think about it, the vast majority of treatment that is given to people who have brain health issues is designed to change the chemical composition in the brain. Right now, the change in how we respond to brain health calls is desperately needed. We're announcing a new program that's a first for Minnesota, maybe a first in the country, and maybe even in the world. I have not found another place that is doing what we're proposed doing today. This program today, I believe, will accomplish three things: decrease the amount of people in crisis that have to wait a significant amount of time before getting brain health or mental health services, decrease the number of times our police officers have to respond to nonviolent mental health calls, eliminate the cost barrier for in-home therapy. Joining me today is Commissioner of Public Safety, Bob Jacobson, is back here somewhere. How you doing, Bob? All right. And Dr. Eric Melby, Superintendent of Bloomington Public Schools, and also available to answer questions is Dr. Nick Kelly from Bloomington Public Health, and Assistant Attorney General for the state of Minnesota, Evan Romanhoff. The thing about the Assistant Attorney General is he was the one that really spearheaded the opioid settlement lawsuit. So we jokingly call him the expert in Minnesota regarding the opioid settlement. Last year, our police officers responded to 1,115 calls related to mental health crisis or suicides. This year so far, we've responded to 952 calls. I've long believed, whenever possible, police officers should not be responding to nonviolent mental health calls. And I'm going to step aside here for a second. Everything on this belt, I'm nice, but everywhere I go, I bring the tail of the criminal justice system with me. In society, I think we really, and I've been pushing this, we really need to start asking the question, where do we want the tail of the criminal justice system not to go? In 2021, our embedded social workers who are from Hennepin County had 1,028 referrals. In 2022, they had 584 referrals. So far this year, we're at 691 referrals. Our social workers follow up after initial call, but when they're following up with people, they're often finding that these folks need immediate therapy. But unfortunately, that immediate therapy is rarely available. A lot of the wait times exceed 2 months. And when it is available, there's a cost barrier for some of the folks that we see. Without professional treatment and intervention, the potential for repeat incidences increase. Our mental health rapid response pilot program will change this by embedding 2 licensed marriage and family counselors within our police department. These 2 therapists will supervise 4 students who are completing their clinical practice to become fully licensed therapists. These students will be supervised by our licensed therapists, and they will provide rapid response to individuals who are needing mental health services in our community, who are referred to them by either us as the police department, the fire department, our school partners, that's what a superintendent is here today, or our Hennepin County embedded social workers. Once the students are here, we will have the capacity to see approximately 40 appointments a week. A client can see a provider for up to 10 weeks, so if someone seeks these services, we're hoping that we can get them back on track within 10 weeks. Appointments will be available in person and at their home or another location in which they may feel comfortable receiving the services. Individuals will receive these services at no cost. And yeah, I did say that. They will receive the services at no cost. This pilot program is going to cost us $63,000. Part of that is paid for with the state's opioid settlement funds, and part of that will be paid for out of the recently signed public safety aid package that Governor Walz signed this past legislative session. We have found that most calls regarding mental health issues also deal with substance abuse, specifically opioids. Our department has responded to 361 overdoses calls since 2019, including 70 this year. There have been 47 fatal overdoses in the city of Bloomington in the last 5 years. 47. That's why we propose using opioid settlement funds in addition to public safety aid that was passed this legislative session to help deal with this. This program is different, but different is what we need if we're going to be more responsive and effective in how we deal with the human debris field left in the wake of unapologetic profiteers. Many of those who are left in this human debris field are friends, neighbors, and family members. Mental health services should not be delayed, nor should they be a barrier to receiving critically important help. We are working to ensure that those who need help are being served with compassion and treated with respect. Today, we are, as an agency, are also going to sign on to the Police Assisted Addiction and Recovery Initiative, PAARI, which looks to create non-arrest pathways to treatment and recovery. So with that, I'll bring up Minnesota Department of Public Safety Commissioner Bob Jacobson.
Good morning. Thank you, Chief. Appreciate it. My name is Bob Jacobson, Commissioner of Public Safety for the state of Minnesota. Regards from Governor Walz, who had wished that he would be able to attend this morning, was unable to make it, so I'm here today in his stead. One of the things that I wanted to talk about today very briefly is, again, just the success of the $300 million public safety aid package. Thanks to our legislators and the governor's leadership, that was passed this year. The whole process was designed to be able to give local communities, whether it be cities, counties, or tribal nations, the ability to use public safety money and to use it largely to their discretion, their best ideas, their best suggestions on how to address public safety issues within their community. The hope was always that that public safety aid would go back to communities and that they would discuss with their partners around their communities as to how best to use those funds to address public safety issues in their communities. And I want to give kudos to Chief Hodges, the mayor, and the city of Bloomington for their willingness to partner and to communicate with those in their community to find the best way to use those public safety funds to address issues that they have identified in their communities. And in this instance, I think stepping out, being one of perhaps the first or one of the first in the state or the nation to come up with a program similar to this, using community partners, involving the school district, involving mental health specialists, I think is a great way to demonstrate how you can be creative to use those public safety funds to increase public safety in communities. And so I want to applaud and acknowledge and thank Chief Hodges and the City of Bloomington for doing that. I think if we are able to use this as a roadmap perhaps for other communities to follow, to be able to work with their community partners, find out what works best for them to use those funds in the best way that they see is needed for their communities. I think that's a great step forward for the state of Minnesota. So I want to thank Chief Hodges again for the invitation to be here today, and on behalf of Governor Walz, congratulations and thank you. Appreciate time being here.
Hello, everybody. I'm Eric Melby. I'm the superintendent for the Bloomington Public Schools, and I'm happy to be here today. I'd like to take the opportunity to remind everybody that we're back to school as quote-unquote normal in public schools, but really we're still coming back from 2 years of disrupted learning, a pandemic, COVID. Even before COVID hit, roughly 20% of our students had diagnosable mental health disorders, and I believe that's increased coming back from COVID. And you know, when kids have mental health issues, that manifests itself in behaviors that we don't and they don't want to see in schools. It can manifest itself in poor attendance, in self-harm, all things that take away from learning. So when we're in schools, we obviously provide support, mental health support to students. We do that with school counselors, with school social workers. We have embedded community providers in our schools in Bloomington that can provide more intensive mental health support. We've got embedded chemical health community providers that can provide mental health or chemical health supports to students, but we cannot do it alone. That's why I'm so excited to be up here today. My team in the Bloomington Public Schools has worked with the city and the Bloomington Police Department on this plan. We're happy because once this thing gets rolling, we're going to be able to get immediate crisis, mental health crisis support through this program for our students and families, and then up to 7 follow-up visits in the house with those students and families once we get going. And when you can remove barriers like traveling, the heat of the moment help that's needed, time, money, that's only going to help our students be in school to learn. And I have to point out, because I point it out every time I get in front of a microphone probably, that in Bloomington we're fortunate because we have coterminous boundaries, the school district and the city. We're a big city, we're a decent-sized school district, and we can work well together, I think, because of that partnership. No offense to other districts, but sometimes you have as many as 13 communities trying to coordinate with the school district on things like this. So we're taking advantage of our fortunate situation in Bloomington, and I'm excited to see the program take off.
All right, with that, we'll take any questions you may have. December is when we're going to start. Yep. So right now we have contracts with our licensed therapists, and they're just now going out and picking students. I think right now St. Mary's, graduate school at St. Mary's University. Yep.
Talk about in a perfect world how this would roll out. The call comes into 911. What happens next?
Yep, so right now, the way we're going to be set up is, say, for example, our officers respond to someone who's overdosed. That referral goes to our social worker. Our social worker meets with that person and their family, and it's determined that that person and their family needs therapy and they need it now. Then we bring in the therapist to try to provide that person with, and the family with in-home therapy. Also, if we get that call where there's the 16-year-old kid that doesn't want to go to school, because we get that a lot, we can start referring those people to our therapists also.
So they won't be responding themselves to the call.
Not,
Still be your officers.
yeah, our officers will still be the initial response, or if someone comes in through the schools. Eventually, we would like to get to that point. Like I firmly believe, and I said this earlier, that I don't think police officers should respond to nonviolent brain health calls, but initially the officers will still have to respond, but hopefully we get to that point. And I'm going to belabor this point. There's no real training to send people to these calls yet. And our hope is by doing this program, we can start to develop a training program to where we can send people to these calls as opposed to police officers. And we decided to start with in-home therapists first because in-home therapists are used to going to people's homes anyway. So that just seemed like the most logical fit. And my wife was an in-home therapist, so I kind of understand how that works a little bit.
If they refuse treatment.
That's their option, right? And we will be tracking how many. She asked, what if someone refuses treatment? A lot of people do refuse treatment. A lot of people do refuse services. That is their absolute right to do that. So we will start to track that also, because that's something that I think people want to know, is how many times people are offered something and they choose not to receive the services.
Is there any kind of follow-up, like, okay, they don't want to stay, but we'll call them, go back in a couple of weeks?
Yeah, our folks do. Right now, they still do follow-up. But again, some people are adamant that they don't want treatment, and there's nothing really we can do at that point. I think it was you back there.
I have a question. Does it include families who lose someone? You talked about going to the overdose hall and getting help for the person who overdosed. That obviously didn't pass. Does this program pertain to families that have lost someone? Are you following up with those families as well?
That's what we would like to move into, but initially it's just right now we're focused on crisis response, but initially later on, that's what we would like to also do as the families that have lost someone, because at some point we're going to try to have to figure out other ways in which, as a system, we might be missing some things, so we can make sure that we cover the gap in that. But right now, this is focused specifically on crisis response.
Chief, is this something you see going 24/7 or just during business hours?
So right now, so the in-home therapy piece would be when the clients could meet with the in-home therapist. So I mean, obviously I don't know if we have to pick the students first, but I don't know if they want to meet people at 1 or 2 o'clock in the morning for therapy sessions. I don't know if that happens too often, but yeah.
So in regards to education in schools, will there be any collaboration with these therapists and school resource officers?
Yes, so right now we're working on multiple ways to which the school can refer. So like say our officers come into contact with a student or a family that is experiencing a crisis. They can also refer these people to our social workers or our therapists, and also work with the schools who have similar systems in place. This program, in terms of the schools, is set up to try to supplement what they already have.
Well, I mentioned all the resources that we do have in place in schools, and I see this as supplementing those resources. And really, in my opinion, what I'm excited about all of it, but what I'm most excited about is that immediate crisis support that these folks will be able to provide, and then the follow-up that happens with that. And of course, we'll coordinate with our own services as best we can.
Thank you, Chief. Sorry if you already said this, but how many sessions, would a young person have this therapist or student coming in for 6 months, once a week? When would it cut off?
So for us, initially, right now, it's set up for that crisis piece, and we're set 10 is what we're 10 sessions, yep. And then pass that person off to someone else for a more long-term piece. And the idea behind doing 10 sessions is twofold. One, for the family that does have the resources, that bridges that gap for the 2 months that it's normally taken to get services. And for the family that doesn't have the resources, hopefully within those 2 months or 2.5 months, they're able to secure some type of funding to get resources to get the services. Yes, Mike?
You cited the $63,000 startup for this. How much does this buy in terms of time, and what happens when that money runs out, which it inevitably will? Your demand or your need's not going to go away, so how do you decide how to proceed from there?
So you asked what happens when the $63,000 runs out. So this is a year pilot project right now, and if it's working, then we'll have to go seek additional funding sources. My personal philosophy is, before we go sinking a lot of taxpayer dollars into something, let's try to see what we can, to see if it works or if there's a need for it first. So $63,000 is the initial cost. This gets us a year, and we'll be collecting a lot of data, so we should be able to determine if this is something that is effective or not.
What are the benchmarks to determine if it's effective?
Benchmarks. Well, we're looking at repeat reducing recidivism in terms of return phone calls, because like I said, we had 1,100 and 1,115, I think, calls. I don't know how many of those are repeat calls. We're still trying to dig through that data, but try to reduce the amount of calls that we're getting from repeat offenders, and also reduce the amount of overdoses that we're having. Because like I said, a lot of these people that our folks are dealing with need that immediate assistance. And then also, how many kids are we helping that are coming into contact with the criminal justice system for brain health issues that hopefully we can reduce also.
No social workers will go on these mental health calls, right?
We don't do the embedded, so she has, do social workers in Bloomington go on calls with officers? In Bloomington, we do not do the embedded social worker model. Yep, so we got a partnership with Hennepin County, and that's not the model that they have in terms of their embedded social workers responding to officers on calls, so that's why we don't do that. And I won't get into my personal feelings kind of about my own view of this co-responder model. Like I said, I firmly believe that as police officers, we need to do whatever we can not to respond to nonviolent mental health calls. Yes, ma'am.
So in Minneapolis, if you do 911 call and have a mental health crisis, they'll ask you if you want like an organization to come and help and be part of the call, right? What makes this different than that?
Yep, so you're talking about the, she asked what makes it different from Minneapolis where you call 911 and someone's able to ask for the organization. What makes this different from that, we are not set up to do that yet. This is strictly referral based. So like when someone gets referred to our social workers, either through our police officers, our school partners, our fire department, and they're meeting with people after the fact. It's not that immediate response because we're not set up for that yet. We hope to get there, yes. And it to be effective without dumping a whole bunch of taxpayer dollars into something that we don't know if it's going to work or not.
Chief, just because we got a little bit of a late start here, would you mind just saying, or just an overall kind of comment on the impact this could mean for the community?
So she asked what I think the overall impact for the community is. Like I said, I think we're the first, I know we're the first agency in the state, maybe even the country. I've not found another agency in the world as a police department that provides immediate in-home therapy for people in crisis. I think when you talk to families who need that immediate assistance and they're told you got to wait 2 months to get it, that's a long time to go without getting services. And that's why I said brain health, right? Think if you had an infection in your knee and they told you you couldn't see a doctor for 2 months, right? That's, to me, the equivalent of telling someone who is in crisis, brain health issue, that they can't see somebody for 2 months. So I think this has a potential to have a significant impact on our community. And I think in terms of how we deal with these types of calls and the intersection between law enforcement and brain health, I haven't seen anyone do this. And I think if we're successful here, this will be the model this will be the model that most jurisdictions go to. Any other questions? Thank you. And sorry for the auditorium format. This ain't normally how we do things here.